occurs frequently in men of reproductive age, causing infertility in some instances. In infertile men, hypoactive sexual desire and lack of sexual satisfaction are the most common type of sexual dysfunction. It is as high as 8.9 to 68.7%. Why it is so high? It's very simple. Because why people engage in sex? We know that it is because of neurohormones. The feel-well hormone, dopamine, serotonin, oxytocin, all it is produced as a result of the low performance. The stress that is produced due to infertility, the cortisol, it disrupts the neuronal pathway. Erectile dysfunction and premature ejaculation are evaluated with validated tools, have a prevalence of 1 in 6 in infertile men, and orgasmic dysfunction have a prevalence of 1 in 10 infertile men. As we know, in orgasm, the whole parts of the brain is involved. The sensory, motor, cerebellum, all are involved in a coordinated manner. When all the areas of brain get stimulated, the amygdala gets involved, our old memories comes in play, the hippocampus gets involved, sexual memories, sexual fantasies comes. So when the interplay of hormones comes, the sympathetic and parasympathetic systems comes into actions, and that is why the action comes. In infertile men, what happens is that this rush of hormones is affected because basically they have an altered hypothalamo-pituitary ovarian dysfunction. The altered hypothalamo-pituitary ovarian dysfunction is one of the principal causes of their infertile problem. This altered hypothalamo-pituitary dysfunction causes an altered release of these neurohormones, dopamine, oxytocin, so that the flush of neurohormones gets altered, it leads to this orgasmic dysfunction. In addition, they experience heavy psychological burden because of their frequent visits. They have their frequent cycle monitoring. They have their hormone injections which alter their neurohormones. We know that we are giving infusions of FSH-LH. It leads to an altered hypothalamo-pituitary ovarian dysfunction. The FSH amplitude gets altered, LH amplitude gets altered, LH pulse frequency gets altered, LH frequency gets altered. It all leads to a decrease in or abnormal in the decrease in the secretion of neurohormones, which leads to a dysfunction in the release of neurohormones, leading to this problem. So in addition, there is ecological concern because of their fixed timing. You are asking the patient to have sexual relation on such and such timings. So what happens? After ovulation, they are afraid to have sexual relationship. So at that time, the husband may be having sexual urge. So he may resort to other routes like masturbation, all these sexual conflicts. All this leads to the problem that they have got a totally disturbed neurohormone axis. So the psychological stress, what does psychological stress do? It releases cortisol. What does cortisol do? Exaggerated cortisol totally disrupts the neurohormone pathway. Sympathetic parasympathetic pathway completely gets disturbed. We know that erection ejaculation is totally depending upon the sympathetic parasympathetic pathway. So what happens? It causes sexual dysfunction, and general health alterations can also lead to male infertility and sexual dysfunction. That is why it is to be very clear that when you are dealing with a patient with an infertile problem, you have to take into consideration their sexual problem also. Erectile dysfunction and male infertility are considered proxies for general health, the former underlying cardiovascular disorders and latter cancerous and non-cancerous condition. We have to understand the fact that in patients with azoospermia, they may be having associated genetic problems also. For example, they may be having some genetic abnormalities like Klinefelter syndrome. They may be having undescended testes, which may be due to altered genetic conditions. So which leads to an altered hormone pattern. So it may be due to underlying genetic conditions. They may be having some cancerous and non-cancerous problems. These patients with altered ovarian dysfunctions. They could be having some altered genetic disturbance also. So the concept of erectile dysfunction in infertile men may be an earlier marker of poor general health. That is why we say that they are prone for certain cancers later in their life. So it is an indicator of poor general health. We have to understand that. There is a popular thinking that infertility leads to cancers. But we have to understand that they are prone for cancers. Even otherwise, even if they are not taking infertility treatment, they may be prone for cancer treatment. So what I am coming to the point is that infertile men, they are a marker of a poor general health. Finally, medications used for infertility can also lead to alterations in the neurohormone pathway. That is why sexual dysfunctions can come as a result of treatment also. What does hormone treatment do? It alters this neurohormone pathway. So as such, they can cause, the medications can cause, the burden can cause, the treatment modality can cause, the results awaiting can cause. That is why sexual dysfunction is very common in infertile, both in female and female. The treatment of male infertility might improve the semen quality and reverse infertility-related sexual dysfunction also. In infertile men, an investigation of sexual, general and psychological status is advisable to improve the reproductive problem and general health. So what I mean to tell that, in a patient with a male infertility, you have to take into consideration of their infertility and their psychological status also has to be considered. It's not only related to their, it's very likely that they can have an associated sexual problem because of their altered genetic and hormone disturbance. So infertility affects 12% of men and sexual dysfunction occurs more frequently in men of reproductive age, causing infertility in some instances. Interactions between infertility and sexuality are numerous and complex. Sexual health is directly related to the psychological well-being and the quality of life of male and female. So sexuality is inherent in human beings and intimately linked to their reproduction. Why people engage in reproduction? It is because of the feeling of well-being. When people get engaged in feeling, they get that sense of euphoria. They get that feeling of intimacy. They get that feeling of connection because the whole area of brain is involved. Once a patient is getting a sexual drive, even his routine activity gets broken because that prefrontal area his area of concentration gets broken, because his routine work gets broken, because that part of the brain which is getting stimulated, it affects that part of the brain where the concentration is needed, that function also gets disturbed. So once you are at the height of sexual peak, the whole part of the brain, motor, sensory, hippocampal area, amygdala, where the fight is involved, where the sense is involved, where the fantasies, that perfect blend gives you that orgasm, that intensity, that drive leads to that feeling of well-being. That is driving to the reproduction, as a result of which you are getting a fetus. So this pathway gets altered. So indeed, sexual intercourse will be less spontaneous and will more preferentially occur during the fertile window. It is something guided. The doctor asks you, you do intercourse in such and such a period. Hence, sexuality will be deprived of the recreational component.
Yes.
Why sexuality is primarily? We do sexuality because of its recreational component. Because the flush of dopamine, the flush of oxytocin, the flush of serotonin, the flush of neurohormones it releases, that gives you that flush, that particular state of mind where we have to understand, when you are stimulating the clitoris, you are actually stimulating the brain. When you are stimulating the vagina, you are stimulating the brain. The whole mind and body complex is involved in sex. So the clitoris is stimulated, what is stimulated is the brain. So what happens is that recreational and erotic activity of sex will be only intended for procreation. So they are involved, even though they are involved in sex, their mind is not involved in it. So what happens? Sexual intercourse will become obligatory, it is repetitive, it is mechanical, so few emotional.
Calendar sex.
Yeah, guided sex.
Calendar sex.
Yeah, calendar sex. So the medical procedure and requirements will alter sexual behavior and the couple intimacy. So medical terms can be perceived as hostile and can generate anxiety of infertility, which could ultimately lead to temporary sexual dysfunction, and many men will consider infertility as a loss of masculinity. When somebody says they don't have a child, in our society we feel that they are less masculine. That is, even in the modern era, that is how we consider it. And virility, and suffer a feeling of low self-esteem and depression in infertile men. So what happens? The medial part of the forebrain gets affected. The medial part of the forebrain is very much involved in sexual activity. Once depression comes, once the medial part of the forebrain gets involved, the sexual arousal becomes less. The necessity to identify sexual dysfunction and their severity is crucial before getting into individual infertile treatment. Sexological and psychological consideration should be seriously considered during the diagnostic and therapeutic phases. There is insufficient knowledge how azoospermia affect male sexuality. Azoospermia, in the absence of spermatozoa after centrifugation of complete semen sample using microscopic analysis. Here we have to understand that there is a strong genetic component in this case. So this genetic component can lead to alteration in the receptor level also. Their testosterone will not be able to do a proper receptor level activation. So even though their testosterone level may be normal, the receptor level, because of gene mutation, the receptor level activation may also be getting altered. So azoospermia is totally a different issue altogether. It all can lead to severe problems in infertility. So in the beginning of infertility management, men will experience doubt about their fertility. Indeed, the emotions around trying to conceive can be more challenging than the treatment for infertility themselves. So men will have the tendency to adjust their sexuality to the process of conceiving a baby. In addition, men will have more difficulty than women to enter into an ART process, as male infertility can be considered as a loss of virility and masculinity. In female also, we have to very well understand the fact that endocrinological problems account for a major cause of infertility. They have got an abnormal FSH LH release. So they have got altered LH pulse frequency. LH comes in irregular frequency, students. Its amplitude also gets altered. Once this altered hypothalamo-pituitary ovarian axis is there, neurohormone hypothalamo-pituitary ovarian axis gets disturbed, it could lead to their dysfunction and could cause the problems. Medical team expectation, medical investigation, and female expectations can lead to sexual dysfunctions in both the partners. The patient will have to produce semen sample in the laboratory. Producing semen in the IVF is very stressful. It is anxiety and stress associated. Semen on demand, when you that there is so much factors behind it. Many men will fail to get an erection because of situational anxiety. The time to ejaculation length is associated with semen parameters. The whole staff is waiting for your semen sample. It's not a simple thing. Now they are looking at the sample, they are looking at the volume, they are analyzing it, they are going to give you the result. The staff says this is your, it calls for your masculinity and virility. Then the doctor is going to examine, your wife is going to know about it. It is a look on your masculinity. That is, it's normal. We should think as if we are on that side. And we have to understand that this fellow is asked to refrain from sexual activity after ovulation. After ovulation, after ART treatment, they have to abstain. So most of these patients have to resort to other forms of sexual activity, including masturbation. So once they resort to masturbation, pornography, fantasies again lead to problems. So what happens is that all these things lead to problems. What I mean to say is that infertility causes a lot of distress in the couple. Both in male and female, it can lead to sexual dysfunction in both. The pathway is very intricate and complicated because it is due to an intricate pathway in the neurohormones. It could be genetic, it could be hormonal disturbance, it could be All these interplay of factors, social, cultural, all these factors pull into. So any patient coming to you with male infertility or female infertility, their psychological and their sexual, this has to be taken and has to be treated accordingly. Thank you.
Very nice. Useful and wonderful presentation.